Okay. Hi, Mr. Woodring. I'm Sandy. I'm going to finish the second half of our assessment we started a little while ago.
Okay.
I just washed my hands a minute ago, but I'm going to, since I've walked in through the door, I'm going to just put some hand sanitizer on. While we're doing that, can you please tell me your name and date of birth?
Mike Woodring,
Mm-hmm.
11/1/1967.
Okay, that's different than the last time you gave me one. That's good. And just because I'm going through that right now with person and place and name and things like that, could you tell me where we are?
Bel Air, Maryland.
Okay, and can you tell me what time it is?
8 a.m.
Woohoo! Okay, that's it is what it is, right? Could you tell me what you had for breakfast?
Bowl of cereal.
Bowl of cereal. Okay, and your mom's birthday.
April 14th.
All right, I'm just ask you a silly question. If you were to find a letter out on the ground outside, what would you do with it?
I would try to mail it.
And if that didn't work?
I'd try to find the person's return address.
Okay, and then I have just one more thing for along this whole pathway too is, can you count backwards from 100?
Yes.
I guess I hesitated too long. Could you count backwards from 100 by sevens, please, for me?
100, 93, 86, 79, 72, 65, 58, 51, 44, 37, 30, 23, 16, 9, 2.
Did you have coffee too? Because you would need that. That's great, thank you. Okay, so now I'm going to just, from where we were with our last, I'm missing one of my pages, that's great. Here it is. So I'm going to, we didn't do an abdominal exam last time, so we're going to go ahead and start with that. So I'm going to have you take off your shirt. Thank you. And then I'll have you lay down in a minute, but while you're sitting, well, actually I'm going to have you lay down because I'm going to check your stomach out for the contour, symmetry on both sides, the shape, and see if you have any scars or any tattoos there. Look for any stria, if you have any stretch marks or anything. I think last time we talked to you, it said you had lost some weight, so that wouldn't be unrealistic to find. And then want to make sure that when you breathe in, that your abdomen actually goes posteriorly in with inspiration as it's supposed to, and that it's symmetric when it does that. Okay, if you could lay down, that would be great.
Okay, like so?
Yep, that would be great. All right, and I'm just going to check and make sure we're all good here. Take a good breath for me. And breathe. Good job. Okay, everything looks good, everything's smooth, everything moved up and down as it's supposed to and very smoothly. I am now going to listen to your bowel sounds.
Told you I had Raisin Bran breakfast ready.
Well, we want to hear some noise in there anyway. Yes, you did. All right, I'm going to listen to the liver and the spleen and listen for any rubs that I might hear, and I'm going to use the bell and the diaphragm for that. And now I'm going to listen to your aorta, your iliac, your renal arteries, your aorta, your iliac arteries, and your femoral arteries. Again, using the bell and the diaphragm. I'll be listening for bruits. Iliac, the renal, the iliac. And I'll do the femur when I get down there. I'll just keep listening with the bell now. renals again with the bell. Iliac with the bell. I'll do femoral with the bell. Also with the diaphragm. And the diaphragm on this side. And while I'm here, I'm going to go ahead and palpate your inguinal lymph nodes, and I'm going to feel the horizontal and the vertical group. Okay, I'm not feeling any lymph nodes, any swelling, any masses, any lymphedema or swollen nodules in there. Okay, and then now I'm just going to palpate your abdomen. I'm going to do a light palpation first and go around. I'm going to be looking for masses and any tenderness. Or is there any area that's tender on you right now?
No.
Okay, well, we're going to find out, won't we?
Yep.
All right, so I'm going to go lightly and go around, and I'm just going to feel for any kind of masses that might be in there, some tenderness that you're not expecting to feel. So far, so good. Now I'm going to go just a little bit deeper and try and find anything that might be in there that's not supposed to be in there, and make sure all is good. All right, now I'm going to go really deep, make sure there's no masses that I can feel. The colon feels good. All right, I don't feel anything there. I don't feel any ascites. Feels good. I'm going to now percuss. So you're going to, I'm going to bang on it and listen to the different sounds in the stomach. It should be very tympanic. If it goes over an organ or a bone or something solid, it's going to be dull. So I'm going to listen for the difference of that. And you can just relax. And then I'm going to, while I'm here, I'm going to check and see if I can feel your bladder or percuss your bladder. If it's full, it would be dull. But I'm not hearing anything. You must have just went to the bathroom not too long ago. Okay, and then now I'm going to feel for your liver margin. So I'm going to go up and down. So I'm going to start at the mid-clavicular level around the umbilicus area and kind of percuss up. And then once I find that spot, I'm going to go from the mid-clavicular line just below the nipple line and try and find where the change of tone comes in. Okay, I felt that right about there. I'm going to put a little mark on there if I can find my pen. Sorry, I'm drawing on you.
Not gonna cut me there, right?
I'm not cutting anything.
Just check.
And then we're going to come down to about the 7th intercostal space. I'm going to do mid-clavicular right there. Touch, hold that. Okay, and that's where it changed from tympanic to dull right there. And I'm going to mark that. And I'm going to just measure it. If I can find my trusty handy-dandy ruler. And that is 4 centimeters, which is in the normal range of the liver span that should be there. So that's good. Now I'm going to do the same for the spleen. What I'm going to do is actually the spleen it may be difficult. I really shouldn't be able to percuss it very well, but what I'm going to do is feel where it would not be, and if I hear a change, then I would think that your spleen could be large, and then when I palpate, I know where to start looking. So I'm going to go over here, and I'm going to be checking for dullness from the axillary line to the mid-axillary line. It remains tympanic. I don't hear any spleen, that there's no dullness there. So that would mean that your spleen is lower than, is in the place where it should be, and would not likely be, would likely not be enlarged. So that's a good thing. So when I go and palpate, I will check that out too. So I'm now going to check, I'm going to do a very deep palpation for your liver. So you're going to feel me, and I'm going to kind of, with your inspiration, kind of dig a little deep under your rib cage a little bit, but I know where I'm going because I've marked it. So I'm going to have you take a good deep breath and breathe out. And again, and breathe out. And relax your stomach as much as you can. Okay. One more time, let's see if I can't get this. All right. Oh, well, there it is. Okay.
I wasn't relaxing my stomach because I'm on film.
Because why? Because you're on film. Nobody cares if you got muffin top. So it was soft, sharp, and regular and smooth and feeling when I found the borders. Now I'm going to do the same for the, I'm going to kind of go over this side. No, you stay where you are. Again, try and relax. I'm blocking the muffin top so you're good to relax. And I'm going to push up from the back and I'm going to push down from this side and see if I can feel it. Take a good deep breath in and out. Okay, one more time. Out. Okay, I don't feel it there either, so that's a good thing. So I'm not feeling any inflammation, any enlargement of either organ, so that's good. Now I'm going to try and find your kidneys. Not always can that be found, but it's going to be a similar thing. I'm going to stick my hand under the back, your flank. No, you stay there. I got this, babe. So I'm going to just stick it under here, and I'm going to again feel here and do a deep palpation. Can you put your, oh, that's part of the problem. Your arms are up. They need to be down by your side. Okay. And then take a deep breath in, relax again, take a good deep breath in, and relax, breathe it out. Again. All right, I didn't feel a kidney there, but that's where it would have been, and I'm going to do it on this side, same thing. Lift up, push up, and I'm going to push down. Go ahead. Breathe in and out. Okay, I didn't feel a kidney there either, so again, I guess that's good. Let's see. Well, I have you down. We're going to do your lower extremity range of motion. Again, I'm going to do a very similar thing that we did, and then I'm going to inspect everything, make sure everything is symmetrical, that there's no redness, tenderness, inflammation, any edema, any peripheral edema or peritibital or pretibital edema. Let's see, and then make sure there's no tenderness. So now I'm just going to, everything looks very symmetrical, nothing looks out of the ordinary. I'll move these out of the way because...
Oh.
Oh.
I'm close to my feet?
No, because you're going to move your feet. So when you... Your feet are not special.
Get me started.
Okay, so we're good, so that's good. They line up pretty well. I'm going to fall on my face, that's good. Perfect. Okay, and I'm just going to feel for any kind of pain or tenderness. Any problems with that? Any pain anywhere?
Not at all, feeling good.
Woohoo! Okay. You have to share your bed with me, I'm sorry. No, you're good, no, it's only a little piece of paper, it's fine. So I'm going to just feel like your super, your anterior suprailiac spine is right here. I'm going to have you roll that way a little bit, top half too. And I'm going to, okay, that's good. And I'm going to come here and find the greater trochanter. Come down here and actually see this is where you sit. And then right in the middle is your sciatic. And I'm just going to push in there and see if you have any pain. You have any pain in there?
No.
Okay, come on back. I'm going to have you do the same thing on this side. There's the iliac crest, the greater trochanter, the spine, and then here is your sciatic nerve. Any pain there?
No.
Okay, roll back for me. All right, I'm just going to move things around just to make sure they go around just fine. Just kind of move them a little bit. All right, and then I'm going to have you do some motions for me.
Okay.
I'm going to have...
Sorry.
Get ahead of the game on me here, right?
This is what you need.
So I need you to take your right knee
Mm-hmm.
and bring it up to your chest. You can grab it, bring it in, okay, and then bring it out. And do it with your left leg. And bring it out. And then lift your leg straight up. No, one at a time. Now the other one. Now this time, okay, you can put it down. And now you're gonna raise it, but I'm gonna put resistance on it. Go ahead. Okay, and then this one. Okay, and now lift one up. And then I'm gonna push it down against my hand. Okay, the other side. Yeah. Okay, thank you. All right, now we're gonna do, now I want you to take your leg and swing it this way, and then swing it this way, as flat as you can, as close to the other one. Right. Okay, and then do it with the other leg. Okay, and then I'm going to have you roll on your side, and you're going to kick forward and back. Does that make sense?
Not really.
Okay, and then
This
so
looks
you
like-
did.
this
So
what
you
they
went
do.
forward. You already went forward this way. So I need you to actually kick backwards. You want to stand up and do this one?
You tell me.
You stand up and do it. Stand up. So you want to go forward and backwards. And don't kick the chair. Okay, kick the chair. See if I care. And then do it with the other leg. Okay. And while I have you up, I'm going to just check your hip and your shoulder and your cervical, your thoracic and lumbar spine. You've got your, I'm going to look at it from this way. You have no deformities. Your shoulders are even. You have good muscle tone. You have the concave, the convexity here, and the concavity here. I'm going to feel your spine and just kind of go in between each of the spine and just make sure there's no pain, tenderness, protrusions. Any pain so far?
No.
All right, making sure that you have no kyphosis, lordosis, or scoliosis. I'm going to check your muscles here. No tenderness, no pain, no problems with that. There's no atrophy with that. And now I want you to bend it over and try and touch your toes. And I'm going to, nope, stay down there. I'm just going to check that. I'm going to check your hip, iliac crest to make sure they're good. Everything looks good. And you can come on back up. All right. Let's see, you can have a seat, please. Actually, I'm going to lay you back down again because I've got to do your knees and your ankles and stuff.
Okay.
So your ankle or your knees, I'm going to feel around and I'll put this by your finger. So I'm going to find the condyles of your femur and the condyles of the tibia and fibula and feel that on the right side, and find the patellar groove, and find the meniscal lateral, the medial and lateral meniscus groove, and check that. And I'm going to do the same on the other side. Any pain or discomfort in any of that?
No.
Okay, and while I'm here, I'm just going to feel it behind the posterior facet of the knee, and I'm going to check for any fullness if you would have any there. Sometimes some cysts can be there and cause some pain, so I'm going to make sure you don't have anything there. All right. I'm going to bend. Now I'm going to do range of motion. So I'm going to do. We're going to flex that, and when you sit up, we'll challenge that one on the other side. I'm going to do this side. And I've already seen you do all that, so it's all good. I'm going to make some strip. Right, so I'm going to bend it here. If there's any pain when I do this, we're going to bend it and twist it in and out and in. Any pain?
Not at all.
Right. Do this one. Out and in. Out and in. Good. No pain. Your knees are good.
Mm-hmm.
That's because you're a runner.
Mm.
That helps it a lot. Okay, that was internal, external rotation. We did deflection and extension of your knees. Let me just see. I think you can sit on the side now.
Okay.
I think I can do some of this. Come down this end a little bit more. That's good, because that way you can kick stuff out a little bit. I want you to push your knee up against resistance, this side. Okay, and then lift it up and then push down. Okay, this side. Okay, thank you. All right, and then you can sit back a little bit because I'm going to do your ankles now. You can put your shirt back on if you want, because I'm done doing that part right now. And I think I did the back with the scoliosis and stuff like that, so we should go with that. All right, and I'm going to just take your, that's your right foot up here, and I'm just going to feel the, palpate the lateral medial malleolus. I'm going to feel the heel, the calcaneus. I'm going to do the NTP joint. I'm checking the metatarsals. I'll get down to the DIP and the PIT joints and make sure they're good. And any pain in any of these?
No.
Okay. Push towards you. Push towards you. Okay. And can you flex yourself and extend? Okay. And then can you, I'm going to take this and relax as best you can, please. And I'm going to kind of check if you go in and out. And then just for giggles, I'm going to let you hold this here and then see if you can hang it down a little bit. If you just relax your knee and take it down to the floor and just lift it just off the floor and just do like circles with your foot. Now go the other direction. Okay. Now I'm going to do the other foot. Same technique. And relax your foot for me. Not ticklish?
Huh. Surprisingly, no.
Okay. All right, and again, push against me. Okay, and pull. Okay. And I'm going to do the other one again with the same thing so I can compare the two. I didn't really get to do that before. Okay, thank you. And again, let's do the up and down and then do the circular rotation and go the other direction. Okay, perfect. Okay. So your toes look good. You have very long toes.
Good for Grammy.
Well, that's good to know. Everything looks good. They're a little cool, but it's a little cool in here, so it's fine. But the joints all seem to move well together, and that's a good thing. So now I'm going to, I lied. Come on, sit back up, please. I lied. Well, I can do it through the shirt, but I'm gonna start at this supraclavicular line and go over to the where am I going over to the summit of the shoulder to the acromion process, and then finding the acromionious clavicular joint. Any tenderness in there?
No.
Okay, I'm going to go down to the deltoid muscle. And find the pectoral groove. Any pain there?
No.
Okay. Then I'm going to go over to the lesser and the major cervical over on this side. Any pain there?
Mm-mm.
And then
No.
the bicep groove. Any pain there?
No.
Good. I'm going to do the same on this side. Any pain there?
No.
Any pain there?
No.
Major, minor, or minor, major, and then the bicep groove. Any pain there? Any
No.
others? All good? Okay. I did check your symmetry before, but I'll double check it now. Everything looks good. You're nice and even. Your shirt's crooked, so it makes it look like you're not.
Adjusting everything.
That's okay. Well, it's because the camera was on. Let's see if I'm missing what I'm doing. So, let me check your elbows here. You can just relax your arm here. I'm going to check your the lateral medial. Relaxing, honey. Thanks. And I shouldn't call you honey because you're not my husband. So, your lateral and relax. lateral medial epicondyles, your elbow. Make sure there's no pain back there in that joint back there. All good. I'm going to walk my way down, and I'm going to check out your radial ulnar joints were up here. No pain. Radial ulnar joints are actually here. And then I'm going to check the metacarpals and carpals and carpals, and then check the joints and all of that. Any pain in any of this?
No.
Okay. And then I'm going to do the DIP and the PIP, the metacarpal joints. We're doing all that. Any pain?
No.
Okay, nothing. There's swelling, no redness, no erythema, no tenderness, no deformities that I can tell. I'm going to do the other side. Relax, please. Sit up. Relax. Any pain in any of these joints here?
No.
Your elbow feels good. No, in the process there. Okay, come down here and feel the joints there. Body moves fine and freely. Again, no deformities, no abnormalities, no tenderness, no swelling, no redness, no erythema, no signs of infection anywhere. Okay? Okay. Good. All right, so while I've got you with your shoulders, we're going to, so I'm going to have you take your right hand and try and scratch your opposite side shoulder. Any pain or discomfort with that?
No.
It feels kind of good, right?
Yeah.
Okay, you can come on back out from that, and then I'm going to, okay, you can do that, that's fine.
I was trying to get ahead of myself. I figured that was next.
Well, I don't want to mess you up, so this is apparently your assessment, so that's good. So, okay, you can come on back down, take your arm out, and now you're going to reach and scratch the bottom part of your opposite side. Any pain or discomfort there?
No.
Okay, now you can do it with the other side,
Oh,
please.
thank you.
No problem. All right, and then I'm going, then can you move your shoulders up and down, up and down? Okay. Okay, let's see. Okay, now I want you to raise your arm up and bring your arm down behind you. So you might want to stand up for that. Okay, bring it back to normal. Bring it up and take it down. Almost got me. Forgot to do that. Do that arm. Straight up, straight down, all the way back. Any problems, any pain?
No.
Straight up. Okay, down. Okay, thank you. Elbows, I want you to flex and down. Go up. Okay. Up, down. Okay. Thank you. And then can you do this? Straighten your arm because you're doing it from your elbow. That's better. And that arm? Okay, good. And can you do this? Did we do this one? Go push up against me. Okay. And pull back. Okay, good, thank you. Your wrist, I'm going to have you wave. And your other one? No queen wave. And no Miss America wave, okay. Not yet anyway. And now it's the Game of Thrones. Do they live or do they die? Do they live or do they die? Other side. It's just, I did the thumb thing just because I did the Game of Thrones thing, so. And then I need you to grip my fingers.
Oh.
No, grip them, it's okay. Is that as hard as you got?
Can't pull them?
No, don't pull them. The camera does not need to hear that. All right, thank you. Let's see. So now I want you to do this. The other hand. And can you put your thumb across that way? Yes, the bad Boy Scout honor. And then spread the fingers out this way. And then put them back together. And can you put them down here? Open them up. And I'm going to push and you try and keep me from putting them together. I'm going to do this side. Okay, and then keep them out and then, no, keep them in. Now you're going to try and push out. Okay, from this side. Okay, good job. Good strength and equal on both sides. I did your back and your spine already. Let me see. And while I have you standing, I'm going to go ahead and do the assessment of the spine. We should have done that when we were standing, but that was since you're up. Now I'm going to have you do a lateral bend. So that's the side bends this way.
Okay. How far down?
Well, until you, no, but you're losing your posture, so you want to stay straight. So there you go, and then just switch
Tipping over is bad, right?
Okay, that's good. Come on back up. Now you want to twist.
I need more for that.
Okay, watch me. Twist, twist. Any pain, any discomfort?
No.
Okay. Now I'm going to have you walk your regular gait to me and then turn around. Okay, turn around. Then I'm going to have you walk like you're doing 1 foot in front of the other, like the drunk testing, DUI test. And then turn around and do it backwards. Or not backwards, do it going back. And then I'm going to have you walk to me on your heels. Good. And then you get to practice high heels, walk on the balls of your foot now. You're not paying attention to me. That was my assessment, not yours. Heel, now walk to me. You're going to get me in trouble. That checks plantar flexion and dorsiflexion of the ankles and your balance. I checked your gait and your posture, your balance, and your leg movements and your arm swing when you were moving, so that's good. When you did the side bends, that was flexion and extension, and your alignment was good. Everything stayed nice until you tried to go too far because you wanted to exercise too hard. I had already checked your iliac crest, very right under your shoulders like they should be. Now, while you're standing, I'm going to have you keep your eyes closed, feet together. Put your feet together.
Top, bottom of the picture.
Well, okay. Do you want me to check or?
Your call.
Let me see. I'm sorry, taking a break because I'm thinking we might not be in here. So hold on. No, we're good. Do you want to turn sideways to me this way? I don't need to be in it. You can be in it. So I need you to close your eyes, put your feet together, and just stay there for 30 seconds with your eyes closed. So we're checking to make sure you keep your upright position and your posture stays good and that your arm with minimal swaying. This is a vestibular check. This is my Romberg assessment. Alrighty, that's good. And then open your eyes. And then I'm going to close and then have you put your arms out. And just keep them there. And I'm going to quickly push your arms down and then they bring them back up to where you think is right. Okay, thank you. And then while you're standing, I didn't get you to do the knee bend with your gait, so I did that. Can you just do a knee bend for me? That wasn't too crackety. Well, never mind, it was. It's the morning moves. Okay. And then go ahead and sit down. I'm going to go ahead and do the reflexes now. and then I'll do the nerves. I don't have a reflex thing, so I'm going to just use my hand with it. So I'm going to start on this side, and I'm going to do the
Crab mallet.
what? What'd you say?
A crab mallet.
No, here. I just use my hand. It'll be okay. I'm going to do the breaker radialis first, and I'm going to just hit my hand, my knuckle right here, and it should make your thumb jump. Okay, and that did. And then I'm going to come up here and do this one here. Relax. You got to be almost like a puppet on a string. Relax. Is that as limber? Okay. And then just rest it on your leg. That's good. And I'm going to do this one. This is the bicep. Okay, and then this one is going to be actually, just relax it. Let it hang. Just hang. Yeah, there you go. And then I'm going to hit back here, okay? This is your tricep. Okay, that's good. I might have you come sit on the edge of this table. Actually, let me do the other side first. Okay, that was the radial. That was the breaker radial. Now I'm going to do the bicep. Again, be as relaxed as you can. Okay, and then I'm going to do the hangman, or the, why is it not heavy on my hand? Relax it, please. Okay, good.
Mm-hmm.
Okay, and your reflexes are good. And then now I'm going to have you sit on the side of this table, because I think you can.
Exam table?
Yeah, well, that was the exam couch, but I have to, your knee has to dangle so I can. Okay, that's all right, I'll take it from here. Just relax it. Okay. That was the teller. Relax. Okay, and the next one is the Achilles. And I'm going to do that back here. Can you sit back so your knees are there? Okay, there you go. And relax it. Okay, on this side, the Achilles is there. And then I'm going to check for the Babinski sign. You don't have one? Let me try this one. Relax, please. And that should be showing plantar flexion. Plantar reflex, but it really didn't move, but that's what should be doing that. I have to check and see what that means when that's not there. Your arch is good. Everything looks good through that. All right, now I'm going to do the cranial nerves. So this is going to be real fun. Real fun, like.
Where do you want me?
Right there is actually good, I think.
Okay. Should I come on camera?
I'll
Get in my good side?
Yes, you're perfectly on camera. All right, so normally I would have, for a cranial nerve one, I would have you smell. I would have you make sure you could breathe out of both sides and then smell. Do you have any problems with smell? Do you smell things well?
No problems.
Okay, all right. Now I'm going to check your eyes for cranial nerve 2. This is your optic. Gotta have that there. Okay, let me see. I'm going to lower the lights. It is light outside, so we'll see how really this goes. So I'm going to check your eyes, your pupils. Do this side. And then this side.
There it is.
There it is. It's your eye. Okay. They are. Boy, that's bright.
Tell me about it.
So your pupils are about 3 millimeters. They were equal, round, and reactive, and they were accommodating. So at this point, I would, if I had the ophthalmoscope, I would be have you look straight at my nose. I would be looking, using it, looking for the red light reflex, come in, and I'm looking, and I'm going to look and make sure that the optic disc, that there's no bulging or uneven margins. And I'd be looking, I'd be holding here, that, and I'd be looking. I'm going to do the same thing on this side. Use my left hand this time. Red reflex, red light reflex, look in, again, looking at the eye. You're not looking at my nose. Okay. I guess I should say straight, just straight ahead. That's right, you're supposed to be looking point far away, distant point straight, and then I'm going to be looking in. And I'm going to be looking. Make sure everything's good. We're checking the optic nerve and everything is fine. Okay. And then this, I'm going to have you close one eye. And then I'm going to come up from behind and let me know when you can see my fingers wiggling.
Okay.
Okay.
Yep. Yep.
Okay, you do it. Change eyes. Yeah, that's right. All right, do it here.
Yep.
And here.
There it is.
And then here.
There it is.
Okay. And then I'm going to let me just make sure I'm getting this right. Now I'm going to do the 6 cardinal views of gaze. I'm going to have you look right here and then check my finger. Now I want you to follow my finger with just your eyes. So when I move it, just follow it with your eyes. Okay. Now I want you I'm going to clench your jaw. Well, that's strong. Okay. Now this is the fun one. So I get you to raise your eyebrows in shock. There it is.
Give me the bill.
Yeah, your insurance company's getting that. And then close your eyes real tight. And then open your eyes up. That was real tight. Okay, that's better. Frown. That's not the angry frown. There it is. And then okay, smile. I don't like you frowning. Let me see. Can you puff out your cheeks? All right. And then I need you to close your eyes real tight again. Real tight. Real tight. And now I'm going to try and open them. You resist me. Okay. Good job. You can open them up now. Thank you. Okay. I'm going to do the whisper test now for your for cranial nerve 8. That's acoustic. And then so I'm going to just make a noise on this side, and then I'm going to say a whisper something on this side, and then repeat what I say.
Hot dog.
Do it on this side.
Baseball.
Okay, perfect. Do you have any problems with hearing that you notice as I'm trying to fall and kill myself?
No.
Okay. Now this is what I'm going to do the Weber rhyme test. So this is my pretend tuning fork. I promise not to use a sharp end on you. Not that a butter knife is sharp, but I would bang it. I'm going to put it on your forehead here, on the top of your head. And can you tell me which side you can feel or hear the vibrations in?
Both sides.
Okay. Is one greater than the other, or are they equal?
Equal.
Okay, good. All right. I'm going to do the same thing. Now I'm going to hit it again, and I'm going to do the Weber test part, or the rhyme test now, which is where the air and bone conduction test is being done. So I would hit it. I'm going to put it on the bone behind your ear, and let me know when you stop hearing the vibration.
Yeah, I stopped hearing it.
Okay. And let me know when you stop. Can you hear it here? This is in the front of your ear in the air. Can you hear
Yes,
it?
yes.
Let me know when you stop hearing it.
About now.
Okay, so it's the way it should be. The air conduction should be greater than bone. I'm going to do it on this side now.
Okay, stop hearing it.
And let me know when you stop hearing it in the front. Assume, can you hear it?
Yes.
Okay.
And it's gone.
Okay, good. Good job. So I don't have to do the cranial nerve 9 and 10, the glossopharyngeal vagus reflex, so I'm not going to check for a gag. Because we did that pretty much on the last exam, where we had you swallow, make sure you could swallow. We checked that you gagged, and then we looked at the hard and soft palate, that it moved when you swallowed and when you voiced something. So when you said I could see the rise and fall of your hard and soft palate. So now, can you shrug your shoulders up? This is your glossopharyngeal and your spinal accessories, your sternocleidomastoid muscles. Any pain when you do that?
No.
Okay, good. Push that down. Push up. Okay, and now I'm going to push down. No, I'm going to push down. You try and resist me. Okay, good. Good job. Now I want to check your range of motion with your head, and I'm going to check resistance on that too. So can you go like right to left? Any pain?
No.
Up, down. Okay, I'm going to have you push this way, and I'm going to try and resist it. Any pain? Okay, that's good. And this side? Okay, and this? Okay, good. Okay. And then I have your cranial nerve 12, which is hypoglossal. So I'm going to check and see if your tongue, if you could stick your tongue out straight for me. That's great. There is no signs of wasting or fasciculations, and that's good. And now we're going to check some, that's great for your cranial nerves are intact. Now we're going to move to the cerebral functioning test. So we're going to do the rapid motion test.
Okay.
So you can do it one of two ways. You can do them
Miss Mary Mac?
no, Miss Mary Mac's not here, so you can, if you want to do it as fast as you can. Faster? Okay, good. Any problems or coordination is good with that, that's great. Oh, I didn't do your facial, your cranial nerve, the trigeminal, the sensory, and then I did the motor, but not the, so I'm going to touch on your forehead, your cheek and your chin, or your, your forehead, your cheek, and your jaw. And I'm going to touch on different spots. You tell me if it's soft. Close your eyes and tell me if it's soft or pointy.
Soft. 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 Pointy. Soft. Pointy. Pointy.
Okay. Thank you.
Try and trick me.
Well, I didn't realize the pointy was not very pointy. It wasn't a wood, it was one of those paper ones, so it's not as sharp as I thought it would be. Now I'm going to do your finger to nose test.
Mm-hmm.
So I'm going to do this, and you're going to touch your finger to your nose and then to my finger, wherever my finger is. Good. Okay. And I don't see any tremors at rest. When you were holding your hands out before, I didn't see any problems with that. You had the return to the position sense when you did the arms. When I knocked them down, they came back up to where they were supposed to be. Now the other thing, let's see what we got. So now I'm going to do the same thing on your extremities going down with the sharp and the dull again. All right, so let me see what I can, so close your eyes. And just as an FYI, this is sharp and this is dull or soft. Sharp, soft. Okay?
Yes.
Okay.
Sharp. Sharp. Soft. Soft. Sharp. Sharp. Sharp.
I shouldn't talk about yours.
Sharp.
Can you move your hands to the side? Just, I'm hitting your legs.
Soft. Soft. Soft.
Do they feel about the same on each side?
Yes.
Okay.
Sharp. 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 Sharp.
Okay. And then I'm just going to lightly touch on different spots.
Okay.
And it should be a light touch. Do you feel that?
Yes.
Feel that?
Yes.
Even?
Yes.
Feel that the same?
Yes. 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 Yes.
The holly jeepers.
Yes. Yes. Yes.
All right, I'm going to do your toes too at the bottom of your feet, just with the dollar sharp. Do you feel that?
Sharp.
Okay.
Soft.
Okay, I'm going to do it this side.
Soft. Sharp.
Okay, good. All right. And close your eyes and just let me know when you feel a vibration.
Yep. Yep. Yes.
Where do you feel it?
My elbow or area.
Okay. Where do you feel it?
Shoulder.
Shoulder?
No, arm. Upper arm.
Okay.
Thigh. Inner left thigh. Outer left leg. Outer right leg. Top right foot. Side of left foot.
Okay. Let me see. I did your reflexes. Oh, I need to test your object recognition. So I'm going to close your eyes. I'm going to put something in your right hand and tell me if you can tell me what it is.
Coin.
Can you tell me which coin?
A dime.
Okay, good. And then I'm going to put something else in your hand, and if you can tell me what that is, but I got to find it first. That's not it. That's not it. Oh, yeah, this is it.
Bobby pin.
Perfect. All right, then I'm going to put something in your other hand.
Another coin, quarter.
Okay, good. That's all I have.
Can I have the coins?
Nope. No, that's it. And
Complete volunteer.
that's all I have. Thank you for your time. What?
Vision.
Vision? Oh, you're right, I did. I'm so subtle. So I guess, so I want you to, when was your last eye exam?
About 3 months ago.
Okay, you okay?
Yes.
I need your glasses to see, that probably will help. So if you can read hold this about 14 inches away from your face.
Okay.
And about there. Read the smallest letters you can read or numbers you can read.
257325 3M3 GDX.
Which one was that? Okay. Okay, thank you.
Yeah.
All right, so you are about 20/30 with your glasses on, but they're for distance, right?
Yes.
So, okay. You're getting to that age that you may need to have glasses to read. So, sorry, but I'm there.
That's what I said 3 months ago.
Okay, well that's good. Well, thank you for your time, and I appreciate you helping me out.
Thank you.